Hi, my name is Celeste, and my presentation is on the needle exchange programs. So according to the Centers for Disease Control, it is estimated that in the US alone there are about 2.4 million injection drug users. According to these numbers, there are about 1,000 injection times per year. And dirty needles hold the highest risk for drug users who inject, especially when they share the needles. They have a higher risk for infections and diseases such as HIV and hepatitis C. Needle exchange programs are based on the harm reduction model. This model assumes that people will not stop using drugs, but there's a way to lower the risks that are involved with intravenous drug taking. The main purpose for needle exchange programs is to reduce the transmission of HIV and other blood-borne diseases. These programs allow them to receive a free and clean syringe and a place to discard the old and dirty one, which is to prevent the spread of diseases. These programs also offer other services such as HIV/AIDS education, condom distribution, access to drug rehabilitation centers, HIV and STD testing, counseling, safe disposal of needles, and other medical services. Not only to drug users to stay safe and prevent the spread of the illness, they're also offered education in topics they may know little in and are able to become more aware of what they do and put in their bodies. I feel like programs like this are needed because they offer more than just a place to receive new needles. They're also able to receive an education and hopefully change their lives in a positive way to stop putting harmful drugs in their system, but also to get an education on how to stop and prevent the spread of diseases. So in 2015, Governor Pence issued a law that would stop needle exchange programs in Indiana. When this happened, there was a sudden burst in amounts of HIV cases in the state. Pence started an investigation to see where the problem was coming from, and from his findings, he found that first, the outbreak was in many rural communities, which is typically where low income tend to live. Second, he noticed that HIV had to do with needle sharing for the intravenous drug user community, where they were abusing the painkiller Opana. As a result to his findings, he opened temporary needle exchange programs where IV drug users could dispose correctly of their old dirty needles and receive new and clean needles. For this reason, in Indiana, the program was put into place to help lower the spread of HIV and to ensure the safety of citizens of Indiana. Eventually, these programs helped to lower the spread of HIV in Indiana. So we have to ask the question, do they work? The pros and cons tend to weigh each other out, so the program is quote-unquote neutral. However, there's research that shows that people who use intravenous drugs are 5 times more likely to enter a program to seek treatment after going to a needle exchange program, which then means that after entering the program's clinic, they are less likely to leave and inject drugs into their system again. This video has to do with the needle exchange program and whether or not it's a good or bad thing. This video expands from the thought of a needle exchange program is good or bad and talks more about the services that they offer. All right, and to conclude my presentation, the needle exchange programs help those who need help and give a safe environment for those to get the things they need and hopefully eventually seek treatment. Thank you for listening, and I hope this helped you learn a little bit more on needle exchange programs.